If you are in acute pain at the moment, then this video is going to show you 4 simple things that you can do to help yourself get out of pain and get yourself back to your normal daily routine again. So the first thing we need to try and think about is what is first of all going on? Well, at the moment, if you are in acute lower back pain, then there's going to be a lot of inflammation, there's going to be spasm, and there's going to be certainly a lot of pain. So the first thing we need to do is try and get that pain and inflammation down. Now, every time you move, it's going to be incredibly painful. So the first thing you need to try and do is just get yourself into a pain-free position. So just sit or lie, whatever you can, just to help give your body a few minutes of rest from the pain. So find yourself a pain-free position, first of all. The next thing you can try is some anti-inflammatories. Now, it's always worth speaking to your doctor or your pharmacist who can prescribe you the right medication. But anti-inflammatories are going to help to bring some of that inflammation down and going to help to reduce some of that pain. Now, a lot of the time, my patients don't like to take medications, which is fine, it's understandable. But if you are going to take some, what I would suggest is to take the maximum allowed dosage in a shorter amount of time. So for example, take whatever you are physically allowed to take in day 1 and day 2, rather than trying to spread it all out throughout a week. What this is going to do is just hit the inflammation and try and reduce the inflammation as quickly as possible, therefore reducing pain. Now, if you are spreading out the dosages throughout the days or weeks, then what's probably going to happen is you're still going to be in pain, you're still not going to move, and actually you're going to be in pain probably for longer. So inflammation is a very important component of the healing process. But what can sometimes happen is the inflammation can stay for too long and it can end up leading to chronic pain. So what we need to try and do is just get the inflammation down long enough to get you moving again. So speak to your pharmacist, speak to your doctor, discuss with them the most appropriate dosage, and then stick to those guidelines. The third thing is to then start moving. So once you've given yourself a little bit of time away from the pain through the pain-free position, then you've reduced some of the inflammation through anti-inflammatories. The next thing is to start moving again. Now, this might sound counterintuitive to step 1, which is the pain-free position. But if you stay in any position for too long, you're going to continue having pain. It's not going to help you get rid of your pain. So you have to start moving. So the first thing I would suggest is to just do some gentle walking around. Just if you can get up and walk around, then that's great. If you can't, then we'll go on to the next one. The next one is just cat and cow. So what you're going to do is find a bed, or you're going to be on the floor. Just try doing some gentle cat and cow. So don't try and push the range of movement. Start in the minimum amount of movement you can do. So what you're trying to do here is tuck your tailbone under and push your bum out. So you're doing 2 different movements and getting movement through the spine. Now, what this is going to do is get the muscles working. As the muscles working, initially, maybe you will start to feel pain. Hopefully though, you can find some movement without being in pain. What this is going to do is get the muscles pumping and get blood moving through the muscles and help to push away some of that inflammation. So cat and cow gives your spine flexion and extension. So it's very one plane. The next thing you can do is what I would call thread the needle. And what this is doing is now adding in some rotation. And I'll show this again on the screen right now. So thread the needle, you're taking one arm through between the hand and the leg. And from there, you're coming back up and repeating. So you could do this multiple times on one side and then go onto the other side as well. So thread the needle is adding in rotation to this movement. And again, start off with a minimum amount of movement first. And as you find that you start to ease up or start to loosen up, then you can start adding in a bit more movement, a bit more movement. Then from there, in the same position, you can start doing what I would call side bends. So the side bends, you are now keeping your body still. So you're keeping your hands and knees in the same place, but this time you're trying to bring your you're trying to hitch up your hip to your ribs. So you're trying to bend your lower back side to side. Now what you're not doing here is shifting side to side. You're simply bringing your hip bone to your ribs, and then on the other side, hips to ribs. What this is now doing is adding in a lateral movement, so lateral side bending. So in this same position, we've done the normal cat and cow, which is flexion extension. We've done thread the needle, which is some rotation. And now we've added in some side bends, which is lateral flexion or side bending. And then the fourth thing you can do is simply just put an ice pack on the pain. Now, when it comes to ice, I recommend not doing more than 15 minutes. 10 to 15 minutes is absolutely enough. If you do too much, what happens when you put ice is that you're pushing blood away from the area, which is great, it's what you want. With that, you're also pushing away inflammation, but you need blood to help you repair the problem, repair the damage. So if you put an ice pack on for too long, you're also restricting the blood flow to the area, which means potentially you're also delaying the healing process. So you want an ice pack on for about 10 to 15 minutes, then take it off, leave it off for about half an hour, and then you can repeat. So you can get 2 ice pack sessions in per hour. You can do this as many times throughout the day as you like, but you just want to make sure you're not leaving the ice on for too long. Now, all of this is referenced in my free ebook, which is in the description below. So there's a link to my ebook. All you have to do is click the link and you can get the ebook. It takes you through all of this process, not only going through acute pain, but getting out of chronic pain as well. So if you want to read more into this, then get my free ebook. Hopefully that has helped you guys. Really, really simple process, but you just got to keep moving. Acute pain can last anywhere up to a week to 2 weeks, depending on how bad the problem is. Of course, if it is your lower back, what I would suggest is go and get yourself seen to by someone who can also diagnose the problem. What you want to really make sure is that there's not some kind of disc pathology where a disc may be compressing a nerve, in which case if you do have any numbness or pins and needles going down your legs or shooting pains going down your legs, there's a possibility it could be a disc problem. So always go and get it seen to. Make sure there's nothing pathological going on. Hopefully this video has helped you. If it has, please give it a thumbs up. Let me know in the comment section below what's happened to your lower back. How did you injure your lower back? Is it something that you've never experienced before? Or is it something that happens on a regular basis? So I'd love to know how you're getting on, what's happening with your lower back, and what you're doing to try and fix it. Anyway, guys, I hope that helps. Until the next video, stay safe, and I will see you very soon.